Good morning. The decision to pause the use of Johnson & Johnson vaccine was the right thing to do. Out of abundance of caution, we have switched to Pfizer for all scheduled appointments through the St. Louis County Department of Public Health. We don't see this switch affecting our goal of administering at least 18,000 doses a week. Of the more than 100,000 doses that the Department of Public Health has administered, 1,739 of those were J&J shots, less than 2%. Still, I understand the anxiety that comes with such a change in the national vaccine rollout. The recommendation by the CDC and the FDA to halt the use of J&J vaccine shows that the federal government is closely monitoring vaccines as they are administered. In St. Louis County, we will continue our efforts to make vaccines as accessible as possible. Our homebound program this month has reached more than 200 people and their caretakers, thanks to a partnership we have forged with fire districts throughout the county. We are working with community partners to set up pop-up sites in areas where vaccination rates are low, and hope to have more details on those sites next week. We continue working to secure a semi-permanent large-scale vaccination site in South St. Louis County that can remain open well into the summer. 2 zip codes in South County have some of the lowest vaccination rates in the county. I'd like to give special thanks to the Afton Fire Protection District, who last week surpassed giving 10,000 shots. The crews there have stepped up to the challenge and teamed up with other districts to create a robust delivery of vaccines. Meanwhile, we continue to operate our large-scale site in Ferguson and offer appointments at our health department in Berkeley, among several other sites countywide. We are committed to do all we can to get our residents vaccinated quickly and safely. While more shots go into arms every day, we need to remember that COVID-19 remains very active in our community. We have seen an uptick in cases, now averaging 157 new cases per day in St. Louis County. New variants, relaxed restrictions, and a pent-up desire to move about are all reasons for the increase. We still have 2/3 of our population not vaccinated, so we ask folks to continue to take the precautions that have allowed us to get to this point where businesses can be open with restrictions and schools can provide more classroom options for fall. These precautions include getting tested if you have been exposed to the virus or have COVID-related symptoms. For more information on symptoms and where to get tested, please go to stlcorona.com. The pandemic has created financial hardships across the country, and St. Louis County is no exception. We received $29.7 million in federal funds for a rental assistance program. With more than 1,200 applications the first week, we know the need is great. A third-party administrator is working with the county to get those funds out into the community as quickly as possible. We want to keep people in their homes and get landlords the rent due to them. These are funds separate from the $173.5 million CARES Act grant we received last year and the $192 million from President Biden's American Rescue Plan, signed into law last month. Within the coming days, we expect to receive half of that $192 million. I've been in discussions with the County Council on how best to use these funds. On Monday, I sent a letter to the Council thanking them for sharing their priorities as we work together to help our residents and our businesses. We can use these funds to not only continue our recovery from the COVID-19 pandemic, but as an opportunity to invest in the future of our community. I was glad to hear many of the council members express support for continuing to address the immediate needs in our community resulting from the public health crisis. Housing and rental assistance continue to be a top concern among members of the council. Also mentioned as a priority was investing in public health as we look for solutions to address significant health disparities in our community. Other immediate needs discussed include providing more support for our small business owners who have struggled during this unprecedented public health crisis. We expect to have up to 3 years to spend ARPA funds, and this flexibility should allow us to invest in the future of our community. Council members have expressed support for shoring up the county budget as we address potential shortfalls in the coming years as well. And several members indicated support for investment in infrastructure improvements including provided needing upgrades for our roads and bridges and increasing broadband access across the county. Public safety is another high priority for the council, with members pointing to investing in recommendations resulting from the Teneo report. The council will appropriate the ARPA funds, and it will be up to council members to decide how detailed they want to get and how the money is spent. As I have said previously, these funds present a once-in-a-lifetime opportunity, and we must make the most of it. I look forward to continuing the conversation with all council members over the coming months to address the immediate needs in St. Louis County and to build back our community better and stronger. And I'm happy to take any questions.
Dr. Page, we don't have any questions today.
Okay, thank you.